Hi, this is Dr. Highsmith. I'm sorry you had to have a tooth removed, but here's how you can take care of it and make this more comfortable for you. First of all, some discomfort is normal after this, depending on how difficult the tooth was to get out. Some are harder to get out than others. The simple ones tend not to give people a lot of trouble. The ones that were more difficult will sometimes give some pain afterwards. The best thing to take for pain is the combination of ibuprofen and Tylenol. A typical size person, about 3 Advils and 2 extra strength Tylenol are usually sufficient, and that's actually a better painkiller than Vicodin used to be, which we used to use for this stuff, but pretty much nobody does anymore. So, and you can, titrate that down a little bit if you want to. Say if 3 ibuprofens, if you're kind of a relatively small person, 2 ibuprofens, 2 Advils, which is 400 milligrams, plus some Tylenol works quite well for that. That's only if you really need something stronger. For many people, just the ibuprofen by itself works just fine. As far as some bleeding is kind of normal, so what we want you to do is keep some gauze in the area for pretty much the rest of the day. Unless you're eating or drinking something, or sleeping, so you don't want to sleep with gauze in your mouth because I don't want you to swallow it. So keep some gauze in there the rest of the day if you can. And what it does, that stabilizes the blood clot. The reason for that is you want to avoid the dreaded dry socket, which you've probably heard about. What that is where the blood clot actually comes out of the socket for some reason, usually by excessive rinsing, swishing, drinking through a straw, or smoking, all of which raise the risk of a dry socket. And so if you pull the blood clot out, then you got bare bone exposed to your mouth. It hurts like crazy for a week or two, and there's not a whole lot you can do about it. So the best way to handle that is to not get it in the first place. So take it easy on it. Don't do any vigorous rinsing or swishing for a good 2 days afterwards. Keep the gauze on there the first day. Don't sleep with it in that night. You don't need it the next day, but that day you want to keep the gauze in there as much as possible, and we've given you some extra gauze to take care of that. If the infection was bad and we gave you antibiotics, go ahead and take the antibiotics like it says on the bottle until the bottle is empty. As far as things that can be an issue, excessive bleeding is very rare. If you're on a blood thinner or something like that, that raises the risk of that, or if you take aspirin. Possible, not super likely, but a home remedy that actually works really well for that is to bite on a tea bag. The tannic acid in tea bags is a very good coagulant, and so what you can do is take a tea bag, wrap one of those gauze around it in some cold water, and put that in there, put some pressure on that for like 15-20 minutes. That usually slows bleeding down considerably. Okay, things that are a phone call. Say, if this happens, I should, get in touch with the office. Excessive bleeding that the tea bag trick doesn't stop. And that would typically be in someone who's taking blood thinners. In just normal circumstances, that's extremely rare. Severe pain. You mean to have a tooth taken out? Yeah, there's going to be some discomfort afterwards. That's kind of normal. It should not be what we call excruciating. That usually means either a dry socket or infection. Infection doesn't really show its head until 2 to 3 days afterwards. So if there's pain right away, it could be the dry socket thing. If it's fine for a few days and then it starts to hurt, then give us a call and we can advise you on that. So that sounds like, usually it's a dry socket. Dry sockets are much more common on lower back teeth. Upper teeth, it's extremely rare to get a dry socket. Lower back teeth, those are the ones where that tends to happen. Anyway, following these instructions should keep you out of trouble, and we'll see you at the post-op visit. All right, thank you.